topics and opinions expressed in the following show are solely those of the hosts and their guests and not those of W4CY Radio, its employees, or affiliates. We make no recommendations or endorsements for radio show programs, services, or products mentioned on air or on our web. No liability, explicit or implied, shall be extended to W4CY Radio or its employees or affiliates. Any questions or comments should be directed to those show hosts. Thank you for choosing W4CY Radio.
Welcome to the Ask the Expert show on W4CY Radio and Talk4 TV, where we bring you educational information from top local experts in the fields of legal, health, financial, and home improvement. Now sit back and listen to experts in family law, association law, hearing loss, business brokers, home care, along with many other topics. Now here are your hosts, Steve-O and Sophia.
Hey, good afternoon, Dallas-Fort Worth. Welcome to another Ask the Expert show, where we bring you the top experts in the field of legal, health, financial, and home improvement. You know, I get emails from you all, and gosh, we appreciate all the emails we get, and you give me different show ideas. What it is it's not so easy coming on our show. We are normally completely filled up every month, but there's been a topic that you have been writing me about, and it's auto accident injuries. Now, a lot of people can be in an accident and you might not even feel anything or realize anything's wrong after a couple days, and all of a sudden that pain starts. We found one of the top chiropractors in the Dallas-Fort Worth area. The name of the group is Texas Functional Health Centers, and we're just going to call him Dr. B. Welcome, Dr. B.
Thanks so much for having me.
Hey, we are so glad we've got you. People are going to be learning about, there's so many things to learn when it comes to automobile accident injuries, especially when it comes to the back. But first of all, tell us about your practice and yourself.
Sure. Our practice is located near downtown Dallas in the Baylor Hospital complex. We've been practicing for about 11 years, me and my wife. We have 6 kids, so we're always really busy. I've done a lot of education through the Parker University here in Dallas. I did a lot of postgraduate education and personal injury, car accidents, and related situations, things like MRI, through SUNY Buffalo in New York. So the med school up there, and really specialized in taking care of our patients and the biomechanical issues.
Well, what amazing 6 kids. That must, with healing people the way you do, and you and your wife raising 6 kids, that's pretty amazing.
For sure.
So we're going to be talking today. You're going to be with us every month. What are some of the most common types of personal injuries you see at your clinic?
First and foremost, we're going to see a lot of car accidents, like whiplash injuries that result in back pain or neck pain, headaches. We see slip and fall injuries, workplace accidents, anything where we have an injury to the soft tissue or joints.
Well, we just got our first text of the first show. This is a good one. I'm glad you're finally getting an expert in this field. Can he answer what is whiplash?
Sure. Whiplash is a common term that we'll use for injury to the soft tissue in the neck. Typically, we'll damage some of the muscles and ligaments as our head goes forwards and backwards in the accident. It's the speed and acceleration is more than that soft tissue can bear, and so we'll tear some of the fibers. It can tear some of the fibers in the disc as well, and that's where we'll start to get disc herniations. Common symptoms of whiplash are going to be muscle pain, neck soreness, headaches, radiating pain, pain that goes down the arms and shoulders. Most common place we're going to get that is a car accident or a slip and fall even.
When someone gets injured, what should they, let's start off, because it could be a slip and fall, it could be a work-related injury, but let's talk about auto accidents. Which the first thing someone do if they're involved in an accident, basically the next day?
First and foremost, you got to seek medical attention. You got to see somebody you can trust that can analyze the extent of the injuries. Even if you don't feel any pain the day of or the day after, it doesn't mean that you don't have any injuries. So it's very, very important that we check that, make sure that everything is okay and that we don't have any injuries. Important for you to document any of the conditions, any of the feelings that you're having, any changes in the feelings, as well as keeping your medical records with you.
We just got our second text already. This is really good for first time show. This is from Sharon in Mesquite. She wants to know, she said, I had an automobile accident and I was fine for 1 week. And then all of a sudden I started experiencing low back pain for the first time. Could that be from the accident?
Most definitely. Changes from soft tissue injuries can take time to build up. Just because we have a muscle strain or sprain or a ligament strain or sprain, our body's very resilient. It can handle a tremendous amount of injury and accident and still function very well. The compensations that our bodies go through to make them work can make it where we have pain days, even weeks after the original injury. That our bodies go through to make them work can make it where we
of all times.
Sorry.
Wow. All of a sudden your show came up on my cell phone. Now, what are the long-term risks if someone doesn't seek treatment after an injury?
Sure. Ignoring any of the injuries, even minor ones, can lead to chronic pain, decreased mobility, even permanent damage. So early treatment, early assessment and treatment is essential to prevent any of those problems or long-term complications. Things like osteoarthritis and disc damage typically come from things like auto accidents, but years after the original injury.
Well, we just got another text. This is from, I don't know if this is a male or female, Crane in McKinney. They want to know if you treat headaches.
For sure. One of the most common things that we'll see with a whiplash injury or a neck injury is that patients are going to show up with headaches. The way that we treat, the holistic approach to treating the whiplash injuries and the cause of the headaches are going to help reduce the inflammation, increase the mobility, and take the pressure off of our neck, reducing the headaches, and therefore taking care of the reason we had them in the first place.
Okay. Here's Randy in Little Elm. Now, I'm from Dallas. I've never heard of Little Elm. Randy wants to know if do you believe in supplements?
Yeah, supplements are a wonderful use if you know what you're deficient in or if you know what you need, right? So making sure that we use high quality supplements for a purpose is very important for us. There's lots of supplements that are going to help us with musculoskeletal injuries post-accident. Namely, one would be magnesium. Magnesium is a wonderful supplement that's going to help us with a plethora of metabolic conditions, especially when we're rebuilding soft tissue.
What signs are there that someone might need a chiropractic?
Soreness, stiffness, headaches, neck pain, radiating pain. Anything out of the ordinary after an accident is an indication that you need to get it checked out. Make sure that there's no severe injuries or even minor injuries that need to be addressed.
This is amazing. This is our first show, and we're already getting this many texts. This is from Beth. Beth is from Las Colinas. She wants to know, do you do telemedicine?
I will do consults through telemedicine, and I do some remote physical therapy to help some of the patients that just can't physically make it in. My practice is definitely a hands-on type treatment, so it's important that I probably at least see you once in person.
She also wants to do you do physical therapy also?
We do active rehab. It's an essential portion of our rebuilding the way that our body uses our muscles and ligaments on top of the chiropractic treatments.
I got to tell you, I told you this at the beginning before we came on air. I think it's amazing what chiropractors do now. I mean, the techniques, the telemetry, everything that you do now. You used to think of a chiropractor, whiplash, but gosh, you do so many things now with so much success.
For sure. It's amazing the amount of things that we can help people with.
So what should someone, maybe someone might think you're too far, they're in Fort Worth maybe, and it's too far a drive for them. What should somebody look for in choosing a chiropractor?
First of all, somebody that has experience in personal injury. So somebody that has something in their CV that's related to personal injury or treating personal injuries. Hopefully some postgraduate work, analyzing MRIs, x-rays, and biomechanical analysis. It's important that you check reviews. Even if you can find somebody that one of your friends that's been in a car accident and been treated, so a direct referral would be very, very good. And making sure that you do a consult and see if you even like that person. Right? Sometimes treatment methods, offices may not be conducive to you or your condition. This is going to really show my age, Dr. B, but it used to be people would look through the yellow pages, and whoever had the largest yellow page ad, in their mind, they had to be the best. Well, there's really no longer yellow pages anymore. And so now people look at websites. And one of the purposes of this show, that let's say we never know we're going to be in an accident, whether it's a slip and fall or if it's a car accident, and all of a sudden you need a chiropractor. We don't want you to have to choose someone by how their website looks. So we bring you the cream of the cream, the best of the best, and that's what we do with Dr. B. So you know what? You might be a little further away, but it's important that you know that you're going to someone who's really going to help you. Because Dr. B, when you're in pain, it affects a lot of different areas of your life. For sure. Every aspect gets affected when you start having enough pain. You can't sleep, you can't think, you can't work, and all kinds of big life events get affected by having severe pains.
Now, when you're treating headaches, we hear the term migraine. Are headaches, migraines, are they different?
There's different types of migraines and different types of headaches. When we think of headaches, there's tension headaches, or ones that come from the muscles in the base of the skull. There's cervicogenic headaches, ones that come from the parts of the bones of the neck being out of alignment and putting pressure on the nervous system. Some of the migraines that we'll see are the ones that are completely compressing the heads, can come from the neck or even from one of the bones in the skull being out of place. Some of those, most often the migraine headaches that are consistent throughout your life are related to dehydration, mineral deficiencies, and that's where the supplements will start to come back in.
So do you get a lot of patients with nerve pain?
For sure. That's one of our specialties, is dealing with nerve pain.
So how do you care for them?
First of all, it's essential that we find out what's causing the nerve pain, right? Whether it be a bone pressing on a nerve, a disc lesion that's pressing on a nerve, an irritation of the nerve itself, or damage to the nerve itself. Making sure that we know what the origin is and coming up with a holistic and specific treatment plan for that particular injury with that particular nerve.
And then there's pain, and then you hear chronic pain. Mm-hmm. Is chronic pain more severe?
It can be more severe. More often than not, when we think of chronic pain, it's a pain that comes and goes, or it's unrelenting. It's lasted more than 6 months. It's persistent, no matter what passive treatments, whatever medications, stretches you've done, it still remains. There's just a number of different assessments and processes that we go through to help assess what type of chronic pain you have and if it's something that we can help you with.
I like this one, Dr. B. This is from James, Lower Greenville. That's kind of close to you, isn't it?
Yeah, real close.
Yeah, Lower Greenville. Wants to know if you wake up in the morning and you're stiff because of the way you slept, can you cure that?
For sure. Most of the time we've been sleeping the way we've been sleeping for 30 years. Sleeping wrong one night doesn't make a lot of sense. Usually there's something wrong. There's a subluxation process or a muscle spasm. Something's happened to cause us to have discomfort when we sleep. It's important that we assess the parts and pieces that would be affected, what's causing the discomfort and pain, and making sure that we can fix that through a holistic and very specialized treatment plan for that particular condition.
Because you hear a lot, people go, oh, I slept wrong last night.
Right.
So what you're saying really makes a lot of sense. You have slept the same way all your life.
Right.
Why would it be any different?
What changed? Yeah.
Yeah, that's amazing. Now, do you have to develop a personalized treatment for each of your patients? Because I know not everybody's body is the same.
Exactly. So not every human's constructed the same way. Not every injury, not every situation is the same. So it's essential that we assess and analyze all the different components that would lead to a problem. So for us, we're going to do orthopedic, neurological, physical, functional, and muscular exams to make sure we know where the deficiencies are in the person. Put together the process in which it happened so that we can unravel all those things and get to the root cause of the pain and make sure that we can treat that in the long term and really come up with a solution for the patient.
This is Natalie in Richardson. Wants to know, can you treat carpal tunnel syndrome?
For sure.
You do that?
Oh, yeah, for sure. I've helped thousands of patients with carpal tunnel syndrome. More often than not, the entrapment or the compression of the median nerve, which is what carpal tunnel syndrome is. It's going to be a pain, numbness, and tingling within the first 3 fingers. It's just a compression of a nerve in the inside of the hand here. More often than not, we have a complicated situation in which we have compression of that nerve in more than one place. An interesting statistic is carpal tunnel surgeries are successful less than 30% of the time, because they didn't address all the parts and pieces that we needed to in order to unlock or take the pressure off of that nerve. Traditional physical therapy is very effective, combined with chiropractic and thorough analysis to figure out where the problems are and where the issues are that led to the carpal tunnel in the first place.
Randy in Denton wants to know, how do you determine how many treatments a person needs?
Sure. Everybody's going to be different on this one. Everybody's body heals at different rates. The extent of damage is different for everybody.
Yes.
One essential thing that we'll do is we'll treat somebody until we see either a plateau, so they don't get any better, or they've stayed the same for a period of time with no regression. Those are one of the more important things that we'll do. I do a biomechanical analysis for soft tissue injuries. So if we had whiplash, for instance, I measure the difference or the damage to the soft tissues, and I can give a rough estimate as to how long I think it's going to take for us to stabilize that particular joint again. In some cases, it's as little as a week. Some cases, it's a couple of months.
Dr. B, what are things that people should know? You know, there's a lot of misinformation out there when it comes to chiropractic care. What would you say some of the things are that people don't understand about chiropractic care?
That's a good question. So most people think we're just cracking bones, right? So we're just cracking your knuckles or cracking bone or something like that. A lot of times the procedure that we do does result in an audible sound. And that's just a byproduct of us getting things to move the way they should. More importantly, we're restoring what's called a biomechanical range of motion or normal range of motion. In the presence of normal range of motion, our body functions, it thrives, it can self-heal, it can self-regulate. if we don't have normal range of motion, that's where our body will start to break down. We'll see more inflammation. We'll see more degeneration, more damage to the soft tissues, and our body can't regulate that. So more or less, the chiropractor's there to help facilitate your body's healing process. We're just allowing that normal range of motion or biomechanical movement so that we can help your body fix itself.
How does chiropractic care, how does it complement other medical treatments for personal injuries?
Essential that we work with pain management doctors, orthopedic doctors, even post-surgical recovery. It's very important for us. We're mainly soft tissue, so I'm going to be dealing with ligaments, muscles. If, for instance, somebody's in a car accident or they have bad whiplash, but they damaged a component of their shoulder, a labrum, I can't fix the labrum, but the orthopedic surgeon can. So he can repair the labrum, but you still need to repair the soft tissue around it. So the muscles, ligaments, and everything that's attached to it. So post-surgical, very important. A lot of my patients that have been severe car accidents, they'll have a tremendous amount of pain and impossible for them to do anything. So we use pain management doctors hand in hand so that we can help regulate that pain so that we can get them back to moving and we can start that healing process.
Do you normally have to put your patients on specific exercises as well as how you treat them?
For sure. Yeah, definitely. We use a functional motion analysis, or FPE. It's going to tell us what muscle deficiencies they have, what tight muscles, weak muscles, and what we need to do in order to get those muscles to behave the way they should. Everybody's going to be different in what their muscles are capable of, first of all. Take, for instance, a 70-year-old woman got in a car accident rather than a 20-year-old man. Right?
Yes, that's a big difference.
Completely different between the two. And so very specialized in what we do as far as the physical therapy as well. So when we're doing exercises and stretches, we accommodate every patient and where they're at and where they need to go.
You know, we're coming to the close of our first show, and I want people to know this. Boy, you see a lot of back injuries. I know that, Dr. B. Be very careful when you go to a doctor and they think you need surgery. I always tell people, go to a chiropractor first, because back surgery, I hope you'll agree with me, is a little on the dangerous side. I have friends of mine who wish they hadn't had back surgery. And I really hope that people will come see you first.
For sure. And there's a lot of things that can happen before surgery. I always think of surgery as the last line. I need to try everything. I need to try physical therapy. I need to try decompression. I need to try chiropractic. I need to try herbal medicine. You try everything before I go to that surgery. There is an inherent risk with surgery, so I would never wholeheartedly just walk into something not knowing what the risks are and not knowing that I tried everything I could before I got there. Surgery does have its place, and a good chiropractor is going to know if that's where you need to be. Right. And so they're going to do enough tests. They're going to do enough orthopedic and neurological tests, x-rays, MRI if necessary, to tell you if you're even a good candidate for their care or if you do need to go to the neurosurgeon.
Here's Mike in Lake Highlands wants to know if you agree with acupuncture.
Acupuncture is a wonderful modality. One component is you have to believe in it. Right? If you believe in it, it helps so much. Most of the Eastern medicines and the theories and principles behind it are being proven by science every day. The functional MRIs, the things that we're seeing with those are telling us that the connections between our hands and our feet and all the Eastern medicine lines, they're becoming real every day. It's really interesting to see the research catching up with all the different things that we've known for eons, telling us that we could fix things. So acupuncture is a wonderful adjunct and modality for a lot of people that are in pain. A lot of people that have visceral issues, so stomach, heart problems, headaches. It does help with a tremendous amount of different things.
Well, I told you that these shows go by so fast. Let's give everybody your phone number and your website.
Sure. My phone number here at the office is 469-334-8255. 0624. Our website is TexasFHC, so FrankHenryCharlie.com, TexasFHC.com.
It's the Texas Functional Health Centers. Dr. B, I'm so glad we have you. You'll be back again with us next month on the Ask the Expert Show. Thanks, and we'll see you soon.
I can't wait. Thank you.
It's Dr. B. He's with Texas Functional Health Centers. His phone number again is 469-334-0624. I'm going to give you his website again, www.texas, F as in Frank, H as in Harry, C as in cat.com. We're going to go to break, and when we come back, we've got one of our past shows. We'll see you again next week.
Thanks for tuning in today to the Ask the Expert Show on W4CY Radio and Talk4 TV. Tune in next week and every week to hear more from our experts on personal injury, insurance, air condition repairs, estate planning, Medicare, and many other topics in the areas of legal, health, financial, and home improvement. See you next week.